So, can vasectomy fail? Could you be going along quite happily, trusting in it, and then all of a sudden your partner starts to crave pickled onions at 3 o'clock in the morning and you know you've got a problem on your hands? I'm Snook, I'm a sexual and reproductive health specialist, and this channel is the Kiwi Sex Doctor, where I give you tips, tricks and hacks for a better sex life. There is no doubt that vasectomy is a fantastic form of contraception, but nothing in life is perfect, and even vasectomy can fail from time to time. These failures we group into two separate groups, what we call early failure and late failure. Now, what do we mean by that? Well, when you have a vasectomy, the tubes are shut in one way or another, and there is a certain period of time that you require for you to empty out the system to get rid of the remaining live sperm. Normally a few months, normally a certain number of ejaculations, and your vasectomy provider would tell you what they wanted you to do. At that stage, after those few months, you would do a semen test to check if you are fertile or not. Now, in early failure, men never get clear. They do that test and there are still live sperm present, and these live sperm continue indefinitely. In other words, the failure has occurred in the fact where there has never been a clearance from vasectomy. Late failure, however, is a failure that occurs after clearance. So you've had your vasectomy, you've done your test, there are no sperm, you are infertile, and then sometime in the future, without you expecting it, suddenly live sperm occur, and there we go, partner gets pregnant. So what are the risks of these things happening? Well, look, early failure is more common. We quote a value of around about 1 in every 300 men that have a vasectomy have an early failure. Now, this is very irritating. Clearly, you've gone through surgery and you haven't got the outcome that you want, but you shouldn't have been at risk of an unplanned pregnancy because you will have been told by your vasectomy provider, don't trust your vasectomy until you've done your sperm test and it's clear. And of course, that has never happened. Late failure is much less common, about 1 in 2,000 men that have a vasectomy, but potentially more irritating and certainly more likely to cause an unplanned pregnancy because you thought your things were going okay and suddenly, out of nowhere, the other half gets pregnant. So let's put it into context here. We've talked about the failure being anything from 1 in 300 for early failure to 1 in 2,000 for late failure. Now, if we compare that to any other form of contraception, you'll still see it's pretty good. If a woman has her tubes tied, the risk of her getting pregnant in the future is around about 1 in 200 women. And of course, there's no test to see if she's going to be the one that's failed. And in fact, if you have your tubes tied during a cesarean section, because the tubes are much more vascular at the time, they can repair even easier, the risk of failure during that procedure is probably down about 1 in 60. So look, vasectomy better than having your sterilization as a woman. So what about reversible contraception? Well, the best things we have at the moment are things like the intrauterine system. This is an IUD or a coil, especially those ones that have hormones in them, such as the Mirena, or the implant. These are rods that usually get put into the arm. Again, hormonal releasing. These last long term, usually around sort of 3 to 5 or even 10 years for some of the copper containing intrauterine devices. They're fitted once and they last for that amount of time. Now, the failure rate in these is probably about 1 in 200 down to about 1 in 100. So similar at best to a female sterilization, but still not as good as vasectomy. If we look at other things like the contraceptive pill, well, the failure rate in that, depending on, of course, how good you are at taking it, is anything from around about 1 in 50 down to even about 1 in 10 people per year getting pregnant using those. Condoms even worse, again depending on how well you use them, and things like withdrawal methods, so pulling out before you ejaculate, worse still. Of course, all of these things are far better than not using anything at all, in which a couple who are having sex regularly over a year have about a 90% chance of getting pregnant if they don't use anything. So look, anything is better than nothing. The reversible contraceptives that stay in, like the IUD or the rods, better than most things. Sterilization, similar to those for females, but way better for the vasectomy. However, whatever the statistics are, if you are the one out of the so many, of course that statistic is very important to you. So why does vasectomy fail? Well, in terms of early failure, of course it could be that the surgeon got it wrong. He cut the wrong tube or just didn't cut the tube in the first place. One of the most important things when having a vasectomy is talking to the surgeon, asking them how often they've done that technique, and indeed asking them for their own failure records and their audit of their details. The more often you do surgery, the better you are at it. So make sure you see a vasectomist who knows what they're doing. There are also rare circumstances where people have abnormalities, such as having a third or an extra vas that is not picked up during the procedure. Now that's pretty rare, but of course vasectomy is an extremely common procedure, so these things happen from time to time. However, most people who have a vasectomy failure, be it early, and certainly all the people who have a vasectomy failure after clearance, this is due to the body's ability to heal itself. Now, our bodies continue to grow, replace cells, heal right the way through our lives, and nothing is changed here in the scrotal region after vasectomy. Things continue to remodel and healing can still occur many, many months or even years down the line. So what happens when these tubes are joined back together? So you have a vasectomy, you have a normal tube, you have some form of blockage, cut, clip, or burn, or something like that in between, and then another end of the tube. We are not talking about these tubes wandering around in the scrotum and magically coming back together, joining back together and forming a perfect tube. We're talking about some form of microscopic connection between these two ends. Looking at this under a microscope, we see something that is known as the Medusa's head effect. For those of you out there who are Greek scholars, you know that in Greek mythology there is the Medusa. The Medusa has a female head and has lots of snakes growing out instead of hair. And with a lot of imagination, looking at these tissues under a microscope, you can essentially see the tube and microscopic, what we call microtubules, all coming out and growing at the end of the tube like the Medusa's hair. Now this is just part of the natural healing process. The body knows something's been damaged down there and tries in some way to heal itself, and the tube material starts to grow these tiny, tiny wee little tubes. Now both ends do this, and occasionally one of those microtubules from one end and one of the microtubules from the other end can join up. Sperm are extremely small and can pass through these microtubules and therefore get through from the testicular end of the tube through the microtubule to the penile end of the tube, and of course make its way out and end up with a pregnancy. So this microtubule formation can occur very soon as the vasectomy has been done. So the vasectomy is done perfectly well by your surgeon, but these tubules start to grow and join together in those first few months before your vasectomy. And that's more likely to happen than the same thing happening a few months down the line once you've had clearance, because the healing mechanisms tend to slow down with time. And that's why the risk is much higher before your clearance than after the clearance, why the risk of an early failure is greater than a late failure. However, the healing and the formation of microtubules never stops, and a late failure can occur years and decades even after a vasectomy. And of course, you can't feel this happening. The semen doesn't look any different whether it's got sperm in it or it doesn't, unless of course you look under a microscope. So you can be going along, you've had your clearance, everything feels fine, everything seems the same down there, and suddenly under the surface this microtubule formation occurs and pregnancy comes on from there. What can be even more confusing is that these microtubules, as well as being able to form spontaneously, can disintegrate spontaneously, leading to a failure of vasectomy, spontaneously reversing back to a working vasectomy. Now, we don't rely on that, and if someone has had a failed vasectomy, the advice would always be to repeat the procedure. However, here comes the problem. Your partner has got pregnant, you go and have your semen tested, and it shows that you're sterile. Please, if you are in this situation, do not start accusing your partner of being unfaithful to you, because it is possible that you are one of these men who has temporarily failed. Of course, it is possible your partner has been unfaithful, but I suggest very strongly you do not accuse them of that on the basis that they are pregnant and your semen test has shown no sperm, because you could have been in that situation of a temporary failure. Accusing someone when they haven't been unfaithful to you doesn't go down very well. So what should you do if your vasectomy has failed? Well, firstly, probably feel sorry for yourself, and I feel sorry for you as well. But you are a rare example of what can happen in vasectomy. Most vasectomists would advise for you to have a repeat procedure. The repeat procedure will take a separate part of the vas deferens, so move to another part of the tube and perform an identical surgery in that part. What are the risks of you having a failure after a repeat procedure? Well, they're pretty much the same as having a failure in the first procedure. So although if you're an individual who's had a failure, you may have lost a bit of faith and you think, well, it's happened to me once, it could happen to me again. Statistically, the chance of lightning striking twice to the same person is very, very small. Of course, unless you are that very rare type of man who has got some sort of anatomical abnormality, such as a third vas. But in those cases, it will have been an early failure, therefore you would have picked it up before a risk of an unplanned pregnancy. So I hope that's been useful to you. If it has, please do give me a like and subscribe to this channel. We have lots of other videos about sexual dysfunction, contraception, and men's health issues. Take care of yourselves, and I'll see you again next time.